is from the Salva. She's the coordinator and the alcohol and other drugs case manager first at Liverpool. She's going to be calling on two other people, Linda Lee and also Jolene Mockbell. But please join me in giving a very warm welcome to Michelle Smith.
Thank you. Good morning, everybody. We've had a revamp of our presentation. Unfortunately, Tom Tray, the Headspace Clinical and Operations Manager, couldn't make it today. He's unwell. So I've called upon both clinicians from the Headfyrst program who have enthusiastically decided to come and talk about some of the clinical aspects and the views from a young person's experience of the service as well. So firstly, I'd like to thank the South West Sydney Primary Health Network for the opportunity and support to be able to officially launch the Headfyrst program today. The Headfyrst program is an innovative, integrated AOD and mental health comorbidity service which provides evidence-based treatment and support services. The program has made a difference to the lives of many young people already presenting with comorbid drug and alcohol and mental health issues, as we provide a free and accessible evidence-based treatment and support service. Can you put that slide over? So the Salvation Army Youth Link program have partnered with the Headspace Youth Mental Health Services in Campbelltown, which is One Door Mental Health, Flourish Australia, which is Bankstown, and Liverpool, which is Benevolent Society. So we're working collaborative together to provide the Headfyrst service. So the two mental health clinicians here that are currently working across the three centres in the southwest, as well as me as a part-time coordinator of the program. So we support young people aged 12 to 25 who present with comorbidities through a no wrong door approach. The Headfyrst model was designed in collaboration with health professionals from the Salvation Army Youth Link and the Headspace centres across the southwest. The program has developed as a result of feedback and discussions with young people and their families. It was identified that there's been ongoing frustration that mental health and AOD issues cannot be coordinated or treated concurrently. Common feedback from the young people is that they see many medical clinics as unwelcoming and stigmatising. They often have been through unpleasant experiences in clinical settings. So the Headfyrst program operates from the Headspace centres, which is youth-friendly and has been designed to address the alienating experience of clinical settings. So I'd like to introduce Linda Lee, who is the clinician that works across Campbelltown and Liverpool Headspace sites, and she's just going to run through some of the clinical issues.
Hi everyone. So Headfyrst is obviously integrated care, so we're combining with Headspace and working to kind of really coordinate the care with young people. So Headfyrst utilises a single treatment plan and share care coordination, which takes into account the young person's mental illness as well as their alcohol and other drug use. The Headfyrst model is delivered from a single site where the clinician offers treatment for both of those, so both the mental health and the AOD, whereas in previous times it used to be that young people would have to go to separate locations for for mental health and then somewhere else for the alcohol and other drug use. And so, we're integrated with Headspace, so we're actually, we have the support of the Headspace clinical team. We attend meetings with them and there's a review process with cases as well, and we're able to also refer our clients on to other services within the Headspace centres as well. Headfyrst builds on young people's strengths in order to enhance health, wellbeing, independence and participation in a meaningful life. And I'll just pop you back to Michelle for this one.
So as you can see from the graph, clients entering the Headfyrst system do receive holistic integrated care. From the Headspace perspective, they've got access to psychologists, the alcohol and other drug support workers, psychiatrists, employment services, family support, GPs and exercise physiologists as well. The Salvation Army also, in conjunction, can support them through a case management program that we've got called Headfyrst. It's Follow-on Youth Recovery Support Team. It's a case management program where we will support clients through detox, rehabs, court support centre, link housing, any other needs that they've got. We've also got them support to Reconnect, an early intervention program for youth homelessness. Currently we've got a Drive for Life youth driver training which gives some of our young people access to a driver training program so they can attain their licence, and that's in Blacktown, and we're currently opening up in Campbelltown as well. Adventure therapy, which we do lots of different things with the clients. We'll take them out for a month. We've got a whole activity centre at Blacktown which we can support the young people with. And we've also got an employment and training officer too, which will support people with any employment needs that they've got, helping them to jobs, writing resumes, and any training needs. And we've got a range of training opportunities for young people currently running now, whether it's a forklift licence, first aid licence, warehouse certificate 3 licence, certificate. There's a whole range of training opportunities that they've got there as well. So as you can see, clients accessing that service will get a holistic approach to other services that they can come into connection with as well. So. And Linda.
Okay, so there's 2 ways to refer. There's either direct referral to Headfyrst. We've got an online referral form that's gone out to GPs and that as well. We all through the Headspace centres. So basically, if a young person comes into a Headspace centre and presents with AOD, then there's a good chance they get referred on to us. So that's kind of the 2 ways to get referred. It's easy, accessible, and the good thing about our program is that young people don't actually need a mental health care plan to come and see us. We have an integrated initial assessment, so we're looking at both the alcohol and drugs as well as the mental health. We have different, so obviously CBT, relapse prevention strategies, harm minimisation, psychosocial education, goal settings with the young person. We have exit strategies and follow-up, and that may include the Headspace team as well, where, after they've finished with us, depending if they've come referred from Headspace, then there'll be follow-ups through there as well. And we also will be having smart recovery groups, so that's getting off the ground, and it will be, hopefully in the next few months, we'll have those up and running at Campbelltown. So we have evidence-based treatment. So we mainly use CBT, motivational interviewing. We also use DBT and ACT, but it does just depend on the young person and sort of what their needs are. We look at, resolving ambivalence about drug use, improving coping skills through problem solving, mindfulness, recognising disordered thinking patterns, identifying the cues, helping young people identify the cues and the triggers for their drug use, and helping them to kind of navigate high-risk situations. We're youth-friendly, so the Headspace centres are youth-friendly. They're quite welcoming for young people. It's bright, friendly, music playing. It's really, really nice environment. We've got the overarching aim of harm minimisation, and we are guided, we're quite flexible with our treatment, so we do have the option of sort of doing shorter-term treatment, whether it's just kind of a brief intervention of a few sessions, or we can actually go longer term as well, up to about 9 months at this stage. So it is guided by the young person's goals, so many of our clients don't actually identify drug use as the primary, as their primary goal for therapy. So we do look at what they want to work on, which is often things like the low mood, anxiety, or things like relationships or stress. And a lot of our clients do come in, and a lot of mine come in and just, want help, sort of getting independence as well. Whether that's been sort of prevented because of some things like low mood or anxiety. So. Okay, so we're commenced since mid-March this year, and we've actually, seen over 115 young people. And our typical presentations, We have quite a lot with anxiety, depression, borderline personality, PTSD, ADHD, and we have quite a few that come in for anger management. We have some quite complex presentations, a lot of young people with behavioural problems, difficulty engaging with school, self-harm, relationship breakups, so it's quite a wide variety of presentations that we're seeing. We've got some links with our GPs. We're promoting through network meetings, community events, health sectors, symposiums and interagency meetings. And our clinicians are also linking in with local skills and counsellors.
I'd like to now share with you a story of one of our clients' journey, which has had its ups and downs, but so far we're seeing great success. This young person, I'll just call her Jane. She's in her 20s of a cowed background, so from a culture where there's a lot of stigma and shame when it comes to talking about drug use or mental health. I'll just give you a brief rundown on her history. She grew up in an environment where she didn't have a secure attachment with parents or family. She described what seems like emotional neglect, and she did have one of her parents who was a heavy drug user and who eventually died of drug-related causes. As a teenager, she did form unhealthy relationships, so there was a lot of emotional abuse which continued with other networks. She was using, as a teenager, so she was using cannabis on a recreational basis, but then that did peak to become more dependent. And that was a time when her parent had actually died from a drug overdose, which had a big toll on her in terms of her guilt, the way she perceived it to be her fault, and also the idea that she couldn't have a proper or a healthy relationship with that parent. Her drug use led to her using methamphetamines or ice. So she presented to the Headfyrst program with holding a lot of shame and baggage around that. So initially she was very hesitant, didn't want to talk to me about her background, didn't want to even give me an address or a date of birth because she was too afraid someone might find out she's accessing our service. She was not telling her family at this point, nor her husband. She was married at that point, and she didn't want to talk to him about what's going on for her because of obviously the fear of the shame. And at that point, when she did come into Headfyrst, she was using ice on a daily basis, and that was all discreet without anybody knowing. She was also having troubles with her husband, so they weren't exactly getting along. There was a lot of tension in communication. Her drug use had actually exacerbated the communication pattern because of her angry outbursts and her inability to regulate her emotions appropriately. She didn't have much direction with her life, and all this had contributed to an episode of major depression. She was not taking any medication or antidepressants for that. So in terms of Headfyrst and how we supported her, based on her feedback, she said Headfyrst was the only chance she had to talk about her drug and alcohol and mental health concerns in an environment that was free of confrontation, free of judgment, something she didn't have anywhere else. So during our sessions, we were very client-centred with her, so we gave her the chance to think out loud and give her the sense of autonomy and empowerment that she was in control of her life and she can make decisions to direct her own life. She eventually decided after several weeks that abstinence from all drugs was going to be the best and most suitable approach for her. We worked on reaching that goal with her, so our staff at Headfyrst and with Jane, we actually evaluated that goal and in terms of where she wanted her life to go. So we looked at other things that would come with the abstinence. So we discussed several rehab options, detox, and after a lengthy discussion, Jane had done her research and said she would prefer to go to a rehab overseas in Thailand. Now, for me personally as a professional, that was new to me. However, my role here was to support Jane in that decision, look into that option. So even if it meant calling up the rehab, speaking to the professionals there, giving her my professional opinion about the evidence-based approach those clinicians overseas were using. So I gave her my feedback from my end as a professional. And it did lead to Jane actually deciding she does want to go overseas, and she did that. She did just that. Since going there, or before going there, Headfyrst also looked into the option about whether or not Jane wanted to be a bit more open about what's going on for her and if she can seek any other family support. So we opened up that topic, and Jane then decided, I think I'm going to go tell my mother about what's going on. It's a lot of work to keep that secret, and she did figure that maybe Mum will be supportive after all. With a session, we actually supported her to open up to her mother, and we gave that in-session support where we had Mum and Jane come in and talk about Jane's concerns and her goals, and it went well. It was actually a big positive experience for Jane to reveal what's going on and to see that there are people out there who do support her. And from then on, she actually did get on the plane, did go for a month overseas to Thailand, completed the rehab program, and she's maintained abstinence since. So I'm talking about 5 months at least so far. And abstinence was just one thing she gained, but from what Jane has explained to us, she's developed a better outlook about life. She feels more hopeful. She's now come back with some career and educational goals, and she knows that she wants to probably enter the social work sector and help other people. So she's enrolled herself out of college, looking at training programs she can enter, looking at volunteer opportunities. And she's also developed a healthier lifestyle. So she's put together, with the help of the rehab overseas, she spoke about having a more balanced routine. So she's very dedicated to exercising, having healthy food. She's even now thinking of quitting smoking, and she's also looked more at self-care strategies, which we've reinforced with our Headfyrst sessions. So we've looked at ways to maintain self-care, ways to start looking at like regulating emotion, because we're trying to help her at the base where when she feels better, we're trying to prevent relapse from that end. And so far it has been successful. From Jane's perspective, Headfyrst has not only offered her the chance to speak and the platform to go on and reach the goal of abstinence from drug use, she's also made it clear that she's been linked up with services which she had no idea existed. She didn't realise how much support was out there, formal and informal, and it's something new to her. She was only used to getting judged, only used to getting confronted, so this was a big surprise, and from what she's telling us, that her life has now taken a better turn. She's also now got a more sense of connection and acceptance with other people and with not only just professionals, but she's better able to relate to her mother and also some friends she has. And now she's also still dedicated to self-care, dedicated to living a healthy life, but also has a bigger picture that her life does mean something and that she's got endless opportunities out there. For this reason, she's now reaffirmed her decision to not use methamphetamines or any drug anymore, because she sees that there is a lot going on for her and she can actually do much better in life. So she's one of our success stories, very inspiring, and we're hoping to only hear better from her. Thank you.
Okay, well, we are in a very good spot here because we actually we're thinking that we may not have time for questions, but I think there's a good chance that we probably can squeeze in a few questions here. And I just want to say, before I even open the floor up for questions, what you've just told us and hearing about Jane, to think that there are 115 potential Janes who have already been able to access the service is hugely impressive. So I think a round of applause for that. Did anybody have any questions that they would like to ask any of our presenters here today? Because we do, yes.
You said it was referral via GP. Can they do it via schools, like high schools?
So I'm just going to repeat the question. So are referrals only via GP, or can they be through the high schools? I'll let you answer that.
Thank you. Referrals can be accepted from anywhere. We're getting referrals directly from school counsellors. It can be via the website, via GPs, or you can ring any of the Headspace centres there and it'll just go straight through their intake system and over to Headfyrst that way. So there's a variety of options for that.
Fantastic, thank you. Any other questions? Yes.
I'm based down at Windsor Caribbean, but we come under the Campbelltown Headspace for any referrals. Would a referral come through, would you accept referrals from Barra?
Absolutely.
Okay, so the question was, can referrals come from outside the immediate area? So could they come from Bowral? And the answer is?
Yes, because you've got that connection with Campbelltown Headspace, so definitely just go through the Campbelltown Headspace number and the intake will go straight through there. Yep.
Okay, any other questions? Yes, from down the back. I'm thinking I might actually run down with a microphone. Let me just see if this works.
I just wanted to know if there's a limit to the time you can work with a young person.
No, some people might present with what we call a brief intervention, which will be with a young person for 1 to 2 sessions. Other people, they'll be presenting for 6 weeks and quite intensely. I know a couple of the clients have been twice a week to see the clinicians, but obviously there's going to be a period around the 6 weeks that there will be a review and where to from here, and they will have that provision to go on if they need to.
Okay, we've probably got time for one last quick question. Does anybody else have one question? Is that a question down there? Just down here? Whereabouts? Just here. Okay.
The sense of reasoning and stuff. So what happens when your child is over 25?
With psychosis, so with psychosis, that would be the COMET team or the mental health team. They would have connections with that to be able to support that young person.
Okay, well, I'm sure there are lots of other questions that people will have. Thank you so much. We have our Ask...
That would be partners in recovery as well.
Sorry?
That would be partners in
And recovery as well for the over 25, yeah.
Okay, so Partners in Recovery would be the other service to go to for people over 25. Now, I am feeling that there might be other questions, and that's a fantastic thing. The Ask It basket is the green box down the back of the room, so please feel free to put your questions in that box. There's also one at the registration desk and in the other room as well. It is now time for us to say a huge thank you. Please join me in giving a warm thank you to Michelle and Linda and also Jolene. Really appreciate you presenting on an amazing service.